managing blood pressure. All right. We're going to try to bring that blood pressure down. And I've listed the parameter of less than 135 over 75. Now, I'm not going to get into all the guidelines of what's hypertensive and what's pre-hypertension, what's malignant hypertension. The goal here is to manage blood pressure and bring it down. So this is my roadmap. I'm going to refer to this throughout the entire presentation. So the very first thing we do on risk reduction is try to lower blood pressure. Now, if you look at this slide here, again, I'm going to go back to the United States. Looking back in 1990, we're looking at deaths per 100,000. This is the benchmark that we're looking at. Look at that top part right there. High blood pressure is number one. Deaths per every 10,000 or 100,000. Smoking was number two. And then look at all the cholesterol markers that were the attributors, the risk factors that drove death. So in 1990, if I make this bigger so that you can see it, blood pressure was number one. If we update it to the year 2021, guess what? It's still blood pressure. We've got to manage blood pressure. So when we talk about a more grand policy than just managing cholesterol, let's have a little bit more focus on blood pressure. I want you to think about what high blood pressure does, and I'm going to give you this analogy. Let's imagine that I take a pressure washer out to my sidewalk and I'm pressure washing the concrete to get all the grime and the mud and everything off the concrete. Works really well. But what would I do if I started pressure washing my flower garden? How would those flowers fare? They would not do very well, right? When you have really soft tissue and sensitive tissue like the brain, and your blood pressure is high all of the time, you're pressure washing those sensitive organs. This is one of the contributors of kidney disease, that when we have really high blood pressure, it starts damaging the glomerular nephritis. I can speak with some authenticity about that. I had a son that had a kidney transplant. And so we've worked really hard on monitoring kidney health, and managing blood pressure is a big part of that. I want to show you a little video about blood pressure and what happens long-term when blood pressure is elevated, specifically in the brain. Okay? And I'm going to talk you through this. This video is on YouTube. It's called The Aging Brain, and it looks at a time-lapse MRI, or advanced imaging of the brain, and we're looking at the white matter here and then the gray matter in the brain. So you can compare the scan of a 25-year-old versus the scan of a 75-year-old. Now, many researchers had no idea what those white matter particles were in the brain, right? And over time, we thought they contributed to dementia, but we didn't know why. So doctors thought maybe these are tiny strokes, and we might be able to figure this out if we did repeat imaging of the brain to see if we might be missing some mini strokes that are happening over the years. So they recruited 5 adults that had white matter disease in their brain and then did a scan of their brain every week for 16 weeks. Now, these were asymptomatic patients. They didn't have any symptoms. And they superimposed this special DWI technology so they could identify vascular challenges. So here we go. Week 1, no problem. Week 2, still no problem. Week 3, we start seeing they have some tiny strokes. We go through week 4 and 5 and 6. Now we get to week 7, there's another mini stroke. Week 8, another one at week 9, 10, 11, and in week 12, there's another mini stroke, okay? So now they're going to go back and focus on just one of those cardiovascular events. And isn't it interesting that the study participants had no symptoms? So they're experiencing these mini strokes, but they had no idea. There wasn't a headache. They didn't lose their speech. They didn't get hemiparesis on one side of their body. They're going to go back and look at this technology. And they're really just focusing on one of those strokes over time. And you'll see that after the 16-week period, that white lesion in the brain, the acute stroke has disappeared, but now it's left some white matter lesions in the brain. So the study shows that these unnoticed strokes are likely the cause of age-related white matter disease. And one of the number one theories is that they're occurring because individuals have high blood pressure. These individuals are pressure washing their brain. Now, I know this is a discussion about cardiovascular disease. So why am I talking about brain? Because there's crossover, right? We're so focused on an organ in medicine. We're so specialized. We have cardiologists that just focus on the heart, neurologists that just focus on the brain, and nephrologists that just focus on the kidneys. As primary care providers, we're focused on the entire person. So I'm going to go back. Look, those strokes occurred in week 3. There was 2. 7, 9, and 12, there was 1 stroke, a total of 5 TIAs, but 0 symptoms. Now, just for review, a TIA is this brief or this transient stroke-like event that happens in the brain that resolves on its own, and there doesn't appear to be a noticeable lasting effect. But I just showed you in the imaging, there is a lasting effect. It damages the tissue. It just might be subtle enough that individuals don't realize it. So there's the scan of the 25-year-old. Here's the scan of the 75-year-old, and look at all those white matter changes. Again, I'm pointing out, we think this is in large part a result of high blood pressure. When you get an MRI report back, you're going to see language that the radiologist uses to describe this white matter. Listed on the right-hand side of your screen, they might say, oh, this looks like chronic ischemic brain disease or small vessel disease. Sometimes you'll hear them say white matter disease, leukoariosis, white matter hypointensities, lacunar infarcts, mini strokes, TIA, small vessel disease, or punctate or patchy or confluent white matter that leads to brain atrophy. Okay? So this is so important to talk about in the office, but the patients are likely to give you feedback. Many of my patients will say, hey, Randy, I really don't have high blood pressure. I have white coat syndrome. I came into your office today and I always get nervous when I come and talk to you. You're so intimidating. And so I think I just have white coat syndrome. And so the question we have to ask is, do they have high blood pressure when they're at home? Do they have high blood pressure at night? How about when they go to work? Is their work very stressful? What is that blood pressure when they're stressed? When I have individuals where I think there's a problem and they're pushing back saying it's all white coat hypertension, the next thing I do is I'll do an overnight continuous blood pressure monitoring. This is an ambulatory blood pressure monitoring. This particular device comes from BioBeat. It's about the size of a Zeo monitor, and everyone's wearing continuous glucose monitors. Now you would just wear this on your chest, and using near-infrared and infrared technology, it mounts to your chest, and we're getting blood pressure readings in real time all day long. So you can see, this is the report when I was test driving this device. It shows that my average 24-hour blood pressure was 120. Now, if a patient comes in and says, hey, I got white coat syndrome when I come in to see you, but my blood pressure is good, this test would help me to identify, yeah, I don't have to worry about that. There isn't a high blood pressure problem. It'll tell me the differences between their heart rates during day and night and those blood pressures during day and night and when they're exercising. So if you pay attention right here, my 24-hour systolic blood pressure, 41% of the time is between 125 and 135. And then 47% of the time, it's between 100 and 120. That's a blood pressure. That means that part of my roadmap is not something that I have to deal with. So I would encourage you to consider options like that when you have patients that say it's just white coat hypertension. I want to talk for just a second about what the American College of Cardiology recommends when taking a blood pressure. Let me tell you, it happens in my clinic. People run in, they have to fill out all this paperwork that the reception and the insurance company requires, and then we rush them back and get their vital signs when they're sitting, waiting to see me, and then they go in and sit down and relax. That's not very representative of what their blood pressure is, because if we want a good blood pressure, we should ask people, don't talk to me for a second. Rest your arm at chest high. I'm going to put this cuff over your bare skin. I'm not going to try to put it over your hoodie. I want to make sure your back is supported and your feet are planted firmly on the ground. This is how we check blood pressure, and I can tell you in the majority of the clinical circumstances that I work, this is really not how we're checking blood pressure. So I wanted to just give that feedback because if we're paying attention to blood pressure, that's the way that we need to do it. How do we manage blood pressure? I hope I'm talking to both audiences. There's an audience that manages pharmaceutical agents. I'm part of that crowd. And there's an audience that manages nutraceutical agents. And I'm part of that crowd too. I have all of these tools in my toolbox. I feel very comfortable with prescription medicines under certain circumstances, and I feel comfortable with nutraceuticals. If you only practice one or the other, I'm giving you some ideas about things that you can use to lower blood pressure. So on the nutraceutical side, magnesium can be very good. Aged garlic, I love. Hawthorn berry, I love hawthorn. CoQ10, it actually can make a difference when it comes to blood pressure. So you don't have to be bound to just one style of treatment. You can use what is in your toolbox. That's my message about blood pressure, sweet and simple.
Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.